Okay, y'all, I think we can get started now. People can roll in as they come throughout the night. So welcome. My name is Natalie, and I'm the Executive Director of LatinX Life, a nonprofit that helps bridge the gap between community resources and Latinos in North Carolina. Tonight, the webinar will be interpreted by Only. I will let them take over so they can give us directions for those of us that would like to listen to the webinar through the Spanish channel.
Thank you. Muy buenas tardes. Soy la directora ejecutiva de la organización sin fines de lucro que está hoy trayendo este webinario para todos ustedes y voy a pasarle el micrófono a Sensontle. Hello, everyone. Welcome to this webinar. This is a bilingual space brought to you by the Sensontle Language Justice Cooperative. My name is Rocio, and I'm here with my co-interpreter, Elizabeth. Hola y bienvenidos a todos a este webinario. Este es un espacio bilingüe traído para ustedes por la Cooperativa de Justicia del Lenguaje Sensontle. Soy Rocío y estoy con mi co-intérprete, Elizabeth. Como sabemos, nuestros movimientos son multilingües y se requiere de un compromiso de todos el crear espacios multilingües. As we know, our movements are multilingual and it takes everyone's commitment to create multilingual spaces. Entonces, ¿cómo podemos practicar la justicia del lenguaje juntos? How can we be language justice practice together? Recuerden que hay un solo micrófono y solamente podemos interpretar para una persona a la vez. Remember, there's only one mic and we can only interpret for one person at a time. Es de mucha ayuda silenciar el micrófono cuando no estén participando. Así podremos minimizar el ruido de trasfondo. It is very helpful to mute your mic whenever you are not participating. This will help reduce the background noise. También es de mucha ayuda que hablen en voz alta, fuerte y claro para escuchar su mensaje. It's also very helpful for you to speak up loud and clear so we hear your message. También, por favor, hablen despacio a un ritmo más lento y moderado. Also, please slow down and speak at a moderate pace. También ayuda a respirar después de cada frase, pausar al hacer preguntas o cuando cambia la persona que está participando. It also helps to take a breath after each sentence or pause after asking a question or when there is a switch in speakers. Si hay algún problema con la interpretación, porque va a ser por medio de Zoom, pero ahora les vamos a dar unas indicaciones, déjenos saber inmediatamente. Escriban un mensaje en el chat a una de las intérpretes o si no, a Natalie Marshall. Also, if you're having any issues with interpretation, it will be simultaneously through Zoom, which we will just in a minute talk about how to turn it on. Let us know immediately. Write a message in the chat to either one of the interpreters or Natalie Marshall. Entonces, para acceder a la interpretación se puede ver de dos maneras. Si están por computadora, se va a ver como a la izquierda, y si están por teléfono inteligente o tableta, se verá como la derecha. Si están por computadora, ya ha sido activada la interpretación, así que si van al inferior de su pantalla, verán un globo que dice interpretación. Una vez que hagan clic ahí, tendrán tres opciones. El modo apagado para la gente bilingüe que puede escuchar en ambos inglés y español, o en inglés para la gente que solo quiere escuchar y participar en inglés, o en español para la gente que solo quiere escuchar y participar en español. Si están por teléfono inteligente o tableta se verá similar, pero tendrán que ir a la parte inferior de la pantalla del lado derecho. Verán tres puntos que dicen más. Cuando den clic ahí, tendrán la opción de interpretación de idiomas y después las mismas tres opciones: audio original para la gente bilingüe, inglés o español. Una vez que hayan seleccionado el idioma en el que se sienten más cómodos, pueden poner finalizado y tendrán ya la interpretación activada. So how to access interpretation? It will look like two ways depending if you're on a computer, it will look like the left-hand side, or if you're through a smartphone or tablet, it will look like the right-hand side. If you're on a computer, the interpretation has been enabled, so you could go to the bottom of your screen and you will see at the toolbar a globe that says interpretation. Once you click there, you will have three options: the off button for bilinguals who could listen and participate in both English and Spanish, or the English option for those who would like to listen and participate in English only, or Spanish for those who would like to listen and participate in Spanish only. If you're on a smartphone or tablet, it looks similar, but you have to go to the bottom right-hand corner. There you will see 3 little dots that says more. Once you click there, you will see a menu that says language interpretation. Click there and you will have the same 3 options: original audio for bilinguals, English, or Spanish. You select the language in which you feel most comfortable and then hit done to have the interpretation enabled. Muchísimas gracias a nuestros patrocinadores de hoy, a LatinX Life y al Health Department de Rockingham. Muchísimas gracias por tener esto accesible en ambos idiomas, inglés y español. Thank you so much to LatinX Life and the Rockingham Public Health Department for having us here and having this available in both English and Spanish. Thank you.
Awesome. Thank you, Suzanne, for your services tonight. I'd now like to introduce Katrina White, and she is going to talk about our amazing community partners that made this event possible tonight.
Good evening, everyone. On behalf of LatinX Life Organization, NC 100, Rule Forward, Reidsville Area Foundation, and Rockingham County Department of Health and Human Services, we would like to welcome you all to the Medical Mistrust Forum. As we all know, COVID-19 really shed light on the inequities in our county, with health being the most devastating effects. However, what COVID-19 also done is galvanized us to create platforms that allows us to participate in these discussions. And they're sometimes difficult and hard discussions, but they are ones that need to be had. We will talk about the importance of everyone getting fully vaccinated, how and where you can get those vaccinations, and the Bring Summer Back campaign, hopefully, to dispel some of the myths that you have heard and answer some of the questions you may have. So we also want to let you know that the Bring It Home event will be held on July 10th at Freedom Park in Eden. And what it is a COVID vaccination event. However, we will go under the platform of Bring Summer Back. So it's just a time where the community can come together, have a good time, and if they wish to receive a vaccination. Also, we're working with Disability in Transit organization in Rockingham County. They have provided free bus rides that day from 9 o'clock until 3 o'clock, and to the Freedom Park in Reidsville, in Eden. And anyone who has transportation issues can't come to the park on their own, that service is available as well. And this Bring It the Summer Back is kind of like a Bring It On Home event that kind of capitalizes on what we're doing tonight, tomorrow night, and then on July 10th. And it also serves as a precursor of what we're doing in Rockingham County, which is the Rockingham County COVID Relief Project, which is funded by Kate B. Reynolds and allows us to dig a little deeper into the medical inequities in our community. And it gives our citizens a chance to have a voice. And together we can develop strategies, plans, and address issues effectively, equitably, and sustainably. And we will begin recruiting participants for that. And if you need any additional information, you can contact myself, Katrina White, Merle Holloway, or anyone else here on the panel. And we can share that information. So we have a wonderful panel here tonight. So without further ado, let's get started.
Awesome. Thank you, Katrina, for that introduction. We will have contact information towards the end of tonight's presentation for those of you that would love to go to the Bring Summer Back event, as well as get in contact with us regarding all things COVID vaccine. I'd like to now introduce the medical professionals that will be on our panel tonight. beginning with Dr. Luc Juliana Baraona. She was born and raised in Colombia and moved to Florida in 2001, attending Florida Atlantic University, where she obtained a BS in biology and minored in Spanish and Latin American literature. She attended medical school at Universidad Central del Caribe in Puerto Rico from 2006 to 2010. During her medical education, she had the opportunity to work with cystic fibrosis patients and patients with other chronic pulmonary illnesses, which awakened her desire to pursue a career focusing on the long-term care of patients with chronic diseases. She completed her residency in internal medicine and pediatrics and fellowships in pediatric pulmonology and adult pulmonary medicine at University of Miami Jackson Memorial Hospital from 2010 to 2018. Dr. Baraona lives with her family in Kinston, North Carolina, where she's currently the chief of pulmonary division at UNC at Lenoir Medical Center. Her areas of interest are transitional care for chronically ill children and young adults, patient advocacy, and most recently, COVID-19 prevention and treatments, and access to medical care in rural communities. During her time off, she enjoys spending time with her family and road trips discovering the beautiful state of North Carolina. Our next panelist that we have tonight is Dr. Vita J Bland. She is in private practice in Greensboro, North Carolina, and specializes in clinical hypertension. She is a strong voice in enabling the community to treat hypertension aggressively. Her passion lies in teaching medical students and in clinical research. In addition to being a frequent speaker on hypertension and lipid issues, she's the host of a weekly radio call-in program, addressing health issues and writes a weekly health column. Dr. Bland currently serves as an affiliate assistant professor for the Department of Family Medicine at East Carolina University in Greenville, a graduate of Temple Medical School in Philadelphia, and completing her residency at the University of Maryland. She is a clinical hypertension specialist and board certified on family medicine. Our next panelist that we have is Dr. Denise Hunter. Dr. Hunter specializes in internal medicine and is focused on the care of adults while making use of the best medical science available and caring for her patients. She creates a thoughtful, meaningful doctor-patient relationship while diagnosing and treating chronic illnesses and promotes health and disease prevention. She is passionate about wellness and working with patients to help them achieve the best possible health outcomes. And our final panelist for the night is Dr. Tiffany Morris. Dr. Morris currently serves as the inaugural chair, associate professor of nursing in the Department of Nursing at Elon University. She's the former interim director of nursing and previous assistant director for faculty development and student enhancement for North Carolina A&T School of Nursing. She's the previous Dean of Health and Public Safety for Rockingham Community College, where she also served as the Director of Nursing Programs. Dr. Morris earned her Certified Nurse Educator credentials from the National League of Nursing in 2016 and holds a Master of Science degree in Higher Education with a concentration in Integrative Studies, along with a Master's of Science degree in Nursing. Dr. Morris recently earned a Doctorate of Nursing Practice in Executive Leadership from Grand Canyon University. She's an active member of several community advisory boards, including Reidsville Area Foundation, Guilford Technical Community College, and Davidson Community College nursing programs. She's also a board member of the Rockingham Community College Foundation. Dr. Morris serves as the First Lady and Congregational Health Nurse for Mount Sinai Missionary Baptist Church in Eden, North Carolina. Thank you, ladies, for joining us on this panel tonight. We'll appreciate your insight. Welcome, participants. If you haven't been welcomed already, we are about to begin the panel discussion for tonight. And tonight's panel discussion was inspired by a survey that LatinX L.I.F.E, NC 100, the Rockingham County Department of Health and Human Services, and many other partners collaborated on to gain insight on Afro/Black Americans and Hispanics and Latinx in regards to how they feel about the COVID-19 vaccine. As the medical professionals provide us with their expertise, participants can ask them questions through the Q&A located at the bottom of your screens. Interaction with other attendees may be done through the use of the chat box, also located at the bottom of your screen. So my first question to the panel is, what do the vaccines do? How do they work? And how many types are available?
Let me start with that question. Thank you, Natalie, and thank you to everybody that had part on organizing such a wonderful event. It's very important that we get educated on the vaccines, the importance of the vaccines, and what they really do to our bodies, and what it is true and not true, since it's hard to discern these things from what we hear from every single place in the internet and other places. So let me address that question. So the vaccines, we have at least 4 different types of vaccines. Now, in our country, in the United States, we are using 2 types of vaccines. One is called an mRNA vaccine, and we have 2 types for those. And one is the Moderna, and the other one is the Pfizer. Now, we have another vaccine, the Johnson & Johnson, that is a viral vector vaccine. What is the difference? So the mRNA vaccine, what it does is a piece of information that is in an envelope of fat that comes into your body. It goes to the immune system, and the immune system starts making antibodies against the message in that mRNA. Now, the viral vector, the Johnson & Johnson type of vaccine, it is, instead of having a fat envelope, it has an envelope of a virus that is not causing of disease for people. It has been taught and made of in a lab, and does not cause disease. But what it does, it facilitates that this message goes into a cell to then be presented to the immune system to give the same information and create immunity in the person and the people that receives the vaccine. And the immunity is based on the corona, meaning in the spike protein that makes the little tiny spikes on the virus. And that is how these vaccines can help a person develop immunity without causing disease on them. It's just a message. It's not the virus. You cannot get COVID-19 from them.
Can I also thank you all so much for having this webinar. I want to also add to what Dr. Baraona, I'm sorry if I pronounced it wrong. Oh, great. Those 2 years of Spanish in high school really came in handy right there. I actually had a patient this week, and I just thought I'd share it with you all. Flat out asked me, like, he thought the vaccine was going to change his body. And I know that's a lot of people's fear when they hear they're injecting RNA, they may hear DNA. People just hear a lot of things, especially with this is a new way of getting a vaccine. And I just really want to reiterate that it does not cause disease. Basically, we're using the body's mechanisms that's there. And the vaccine is providing like a blueprint so your body can recognize the virus if it sees it, if it ever sees it. And just really emphasis on it's not changing your body in any way at all. that you're going to all of a sudden turn into a virus, or you're going to turn into something else other than a human being. That literally was my patient's concern. And for some reason, I feel that he's not the only one in the planet that's thinking that. So I just really wanted to reiterate that.
I'd also like to say, and again, thank you so much for inviting me. And this is a wonderful forum. You know, I hear people talk about that they think that they're going to be, have some kind of little transistors that are going to be placed through the vaccine, and that people are going to be, you know, looking at them and trying to see where they're going and what's going on. And I often remind them that this is how they know, people know where you are. This little phone right here, this is how they know. And I also remind them that Bill Gates is worried about his divorce right now. He is not worried about you.
Thank you, Dr. Bland, Dr. Hunter, and Dr. Baraona for your insights. There are definitely a lot of myths and rumors and fears surrounding the vaccine. You've all touched on them a little bit in saying that the vaccine, if I understand correctly, will affect your RNA, not your DNA. And so actually we had prepared tonight to debunk some of those myths if we'd like to debunk them a little further. And one of those myths is that there's lack of evidence that the vaccine is safe for the Black and Brown community. Dr. Morris, would you like to speak on that?
Absolutely, and I'll echo again with everybody. Thank you so much. I will try to speak slowly because this is a passion of mine about educating others about this vaccine. So your question is there evidence? I did some research as well, right? Because I wanted to be able to share with my congregation and family about what was happening. But in the beginning, both Pfizer and Moderna and others, and again, this was my initial knowledge, did the work that needed to be done in terms of how many people participated in these studies. And there were African Americans and other people of color that participated. And even so more now, as we all are becoming more and more vaccinated, data is constantly being collected. And the other thing I want people to remember, it was not like they created this vaccine and said, let's go. There were studies, there was research, there are things being done, even to the point where, you know, we've had a few incidents with some of the vaccines, and the FDA and all of the people have been forthcoming about the vaccine. So people of color, there are other, and genders and ethnicity have been a part of the research and a part of the study. And I always like to give kudos to Moderna vaccine for having a female of color. One of the scientists, she's right from North Carolina, Chapel Hill, as a matter of fact, helped to develop the vaccine. And so to me, that gives us a different perspective that someone that looks like us has been involved with actually creating this vaccine. And so I definitely want to debunk that myth, as you say, because research is still being done. And we're still participating. Of course, put a plug in for us to be a part of those studies to do that. And I like a personal story like Dr. Hunter was talking about. At Elon, we're with physician assistants and the Doctor of Physical Therapy program. And one of the grants was to check on the antibodies. Once you have the COVID-19 vaccine, we're getting tested for antibodies for an entire year. So I signed up. I had my church members sign up because they were looking for, you know, people of color and that. And so we get a free, I think it's a blessing. We get a free COVID-19 antibody test every so often to see if the vaccine is actually still working. So I've been fortunate to be a part of that and share with other people. So there is research there, and there are all types. And I think even now, that's why we held on the younger generation, right? Because they were waiting to get the studies and the results. And then they moved that phase where you're 16 and under could actually receive the vaccine. Same thing with pregnant women. So the research is being done, and there are people participating.
If I could just add a little bit to what Dr. Morris just said, I had, and it's kind of painful because we, of course, not know our history. Many of my patients, just sharing also part of what happens here in my clinic on the day-to-day, saying that they don't want the vaccine because they don't want to be abused by being treated with something that has not been completely investigated and very well understood, since we know, of course, by our painful history that had been done in Black and underrepresented communities. Now, this is something that has been done at a world level. This is not something that is being done only in the United States. And there are all the entities that are making sure that the studies are done with justice and fairness, so we all can participate of them and also take benefit from them. So all the people that went before us, regardless of their color, they were in very well designed research studies that were not only done in our country, and so, minorities were represented in the way that minorities are always represented, which is also in smaller numbers, but we were all there. And it is good and safe to have this type of environment so we can tell to everybody that the studies had not been done advantageously to anyone and have not, hopefully will never replicate all those pieces of our history in which things where medications and procedures were done to our minorities and our communities in a unfair and injustice and abusive manner.
I'd like to also say that I've heard numbers of patients that they worry about the Tuskegee incident, what happened at Tuskegee. And I often bring up, let's understand what happened at Tuskegee. That in that particular incident, they allowed patients who had syphilis to just go on when there was treatment for it. This is not the same thing. They did not take care of those patients in the manner in which they should. So we're not talking about the same thing. And I try to get patients to understand this is not Tuskegee. We are, as the other doctor said, justice, I think, is here. We have people who look like us who are in the upper echelons of this. And I think that is something that we don't have to worry about at this time.
May I also bring up a point? And again, I don't want to sidetrack your conversation, but I think it'll roll into all the myths. So one of the things I did when the COVID-19 vaccine first came out and they were doing it in phases in long-term care, I made it upon myself to go out and be a part of the distribution, right? The actual giving of the vaccine. And when I tell you all that the lines, people were, let me just say this, not the white individuals were in line, crossing states, doing whatever they could do to get the vaccine. And I often share it with my family. I said, now, if this is something designed to kill us, or the government is having some sort of conspiracy, well, then the white people didn't get the message, because those individuals that was where the disparity came from. We found that there were these, all of these individuals getting the vaccine, and we were lagging behind. And so when I went to these long-term care facilities and I was at CVS, and when they were rolling out this, I would give a vaccine and the elderly people would say, thank you so much. You just saved my life. When I tell you they wanted the vaccine. And I don't see people standing in line to volunteer to be killed. And so sometimes we can't always appeal to logic and science. So let's go with the emotion. Why are people coming across states to get a vaccine that was designed to do harm? And it wasn't us, meaning people of color, getting the vaccine. So I think sometimes we have to think about that. We had movie stars coming out and famous people who actually caught COVID-19. So it wasn't a myth, it's a reality. If anybody on this call knows of anybody that died of COVID-19, you knew it was real. I don't know how anybody can conspire nationwide, like Dr. Barahona said. How worldwide can we create this false sense of reality when people were being put in body bags and people were, you know, being funeralized. So the devastation of COVID-19 has been, you know, indescribable. So I just want to encourage people that to take a deep breath in. And if this vaccine was really that unsafe, then a lot of people have been misinformed. And when I'm saying that, these other communities, social, economic, and educated individuals were trying to get this vaccine. I just want you to think about that. Trying to get ahead of us. And so to me, that sounds like, maybe I should think about it, because they weren't avoiding the lines. In fact, they were causing that bottleneck, I call it, from us getting the vaccine. So I just wanted to mention that just as a point of fact, to stop for a minute and think about and forget about social media and the internet and all these false facts, and just think about really what's happening worldwide with this vaccination.
All great points, doctors. I know I was personally unaware that a Black female physician had to do with developing the Mrna vaccine. I don't think many people know that. And so in terms of, is there data that shows that it's safe for our community? Our people were involved from the start of it. And of course, the data is still ongoing and being collected, but medicine is always growing. We're always learning from it. Dr. Morris, I know you touched on a little bit on government conspiracies, and one of our attendees has a question. The question is, what do you tell people who say coronavirus was deliberately created or released by the government so that they could make money on a vaccine?
So I welcome any of my colleagues to join in. I don't want to monopolize the conversation. I'm going to go now to, okay, it costs money to produce. We get it for free. I'm not sure it's being, now it may be sold to other countries. You ladies can help me with that part, but in the United States, it's free, but it costs to distribute. Somebody has to administer the vaccine. As a matter of fact, as an RN, some of those times I was getting paid, right, to deliver the vaccine. So you're paying healthcare providers, pharmacists, materials, and supplies. I don't know how this is a money-making initiative. Now, again, some of my colleagues who in the medical field and maybe, you know, have the business sense, but I'm not sure how we're making money right now, because it's a costly venture, but they can add to that.
I'll just say, for me personally, people are going to believe what they want to believe, honestly. And I am of the school of thought that I just don't argue with people. And I recognize, I absolutely am empathetic and understanding to where this is coming from. And I just really, how I approach those things is just really expressing my understanding that I understand your distrust, but this is what's going on. And let them make the decisions. These are adults, people. I feel that if we give them the information, they're kind of left with the decision to make. And I respect their right to make a decision. And also, we just make sure that we lead with empathy and understanding, and then also give them the information, the facts that we're presenting right here today.
Well, I wish I was more like Dr. Hunter, because I will be wrestling my patients. But I do think that it's important that everybody makes an informed decision. I just think that we are almost in a time that we have, we're too good for ourselves. I mean, we have so much information, so much means, so much resources, that then people has started to wanting to trust everything or the first thing they hear, or the things that appeal to their feelings more that they really appeal to their understanding. And so it's hard. But the other thing that I wanted to add to what you say, Dr. Hunter and Dr. Morris, is that this cost, the virus per se, having coronavirus, cost so much money to the economy that and not only our economy, the world economy, that I cannot think in which reasonable scenario any government will create this type of virus and this type of pandemic, or decide to make a business of the cure or something so horrendous. It costs a lot of money for all the communities, for all the countries to have this pandemic. Many businesses were closed, many economies were affected. But in addition to that, making the investment and making the vaccines has also cost a lot of money to the governments and economies. So I don't know that anybody has made any money yet from this terrible pandemic. Maybe the people that made sanitizer or something, but other than that, nobody else really can. I cannot see that this was an economic maneuver in any way.
Yeah, I definitely agree. Sanitizer companies did make a lot of money as well as masks, but that's okay. Safety first for all of us, right? The next thing that I have, and this is pulled from the survey that we gave, is that 67% of the survey respondents stated that they know someone who had a serious reaction to the vaccine, and that's what makes them apprehensive to take it. Dr. Bland, how would you combat that response?
Well, well, unfortunately, being a family medicine doctor and hypertension specialist, I hear this a lot. And, I talk about what was the reaction that the person had. And I try to explain to them why they may have had that reaction. But the thing that I point out the most is this. Your body is reacting, trying to make sure that if you see this virus, you are able to fight it. That's what your body is doing. And people are not dying, most of the time from these reactions that they have. They are little reactions. You may have a temperature, you may have achiness or something like that, but major reactions, there are some, but they're not that many. And I tell people, it's you want to have this because this will save your life. It will save your life. And the majority of people do not have these severe reactions. And I would rather see you have this so that we can save your life. A lot of my patients have diabetes in addition to having high blood pressure, having cardiovascular disease. And I try to help them understand that they are at increased risk for this. I also have a lot of obese patients also. These are the people who have a lot of problems. And I try to get them to understand that this happens to some patients, a very small percentage of patients, but the majority of people don't have these reactions. And just because you hear of one or two people who may be having reactions, please don't blow it out of proportion. And it certainly doesn't mean that you will have a reaction.
Thank you for that. Yeah, definitely. For individuals, our bodies react differently. And Dr. Morris, I'd love to hear your take on it as well.
Well, I was going to say, I think it was Journal of American Medicine. This was back in February, the data, because I was preparing for another lecture. And if I'm not mistaken, Moderna was like 4 persons reacted per million. And I think Pfizer was just above that, meaning for every million person in terms of a severe allergic reaction. Like Dr. Bland is saying, we've got to distinguish between reacting and having some symptoms or a side effect per se versus an anaphylactic reaction, which means you stop breathing. And like she's saying, no one is, that number is very, very small. And so sometimes we have a tendency that one person, that story gets blown up to magnanimous, and I made that word up, proportion, right? So, but the data, that's the time you do want to stick to your data and look at the number of people out of so many. And like Dr. Bland said, one of the safety nets we put in place is we ask those questions right before you get the vaccine. We watch you for 15 minutes or 30 if you had some of those other conditions. And we have that EpiPen on site. So every time I've given the vaccine, there's safety precautions. And so, like she's saying, people are not having a severe reaction where it leads to death. They may have the temperature, they may have the headache, the sore arm. But when you took the tetanus shot, which most of us had, or a booster or tetanus in school, the tetanus felt worse to me because that hurt. But so I think just when people are thinking about that, check the source. What do you mean by reaction? What do you mean? And is that person still walking, breathing? Then we did our job, right? Like Dr. Bland said, we just saved your life. So I think I just wanted to add the data points for that discussion.
And just to add one thing briefly is also, I tell my patients that if you're having that reaction after you take your second shot, and just, and Dr. Bland kind of like touch on this as well, is because your body is working at it. The vaccine is working. Of course, nobody wants to be sick. Nobody wants to have a temperature, a headache, or nothing. However, it means that after you receive that first shot, your body start building that immunity that when you got the second message, it already had some ground to go from. So that's the silver lining of having that ickiness or those symptoms, that your immunity is working, and the vaccine will work and will protect you. So that is something maybe that has worked with some of my patients, the understanding that it's not that feeling that little sickness is not bad, and it's not that the vaccine is bad, it's actually good, and that the vaccine is working.
I love that positive spin on the symptoms actually being a good thing. It means you're immune. It's doing its job. It's a great take on that. The next question that I have, I believe Katrina White can answer this, as she works for the Department of Health and Human Services. 17% of our survey respondents believe that citizenship matters when it comes to access to vaccination. So if you could please share with the audience what documents are needed to get vaccinated, is health insurance needed, and is citizenship actually a factor?
No, citizenship is never a factor with this vaccination. Identification is not. We have a COVID form that they must fill out just for us to get their general health history. And we're using that to be aware of things that Dr. Morris said, and Dr. Bland and Dr. Barahona said, that, we have a basis for your health condition at the time. Everyone is welcome to do it. We've tried, I know in Rockingham County, we have tried our best to have vaccination clinics where people feel safe. We have individuals there that look like them, and all the information they may have, all the answers to the questions they may have, because I know it's scary, and the climate in this world right now is pretty scary. So a lot of things are taken, it's just like a soup pot of potential paranoid feelings and questions. And so, but no, you don't need insurance. We do ask if you want to bring it, bring your insurance card, you can. And the only reason why we're doing that is because of that administrative fee that the workers have to, to take care of the workers' time and everything, because, we have to get some revenue from somewhere, because during COVID, every other service other than COVID was shut down at the health department. There was no revenue coming in. And that's affecting, a lot of, practices, organizations, restaurants, businesses, you name it. So we've all felt the brunt of that. But short answer, no. Everyone's welcome. Everyone is safe. Everyone is encouraged. If we need to come to you, we will. Because our motive and the important factor to us as far as public health is making sure that everyone has the opportunity to get the vaccination in an equitable and a compassionate way.
Thank you so much for that. We know that the United States and even North Carolina, we're made up of so many nationalities and different groups. And I'm so happy to hear that your residential or your citizenship status is not a factor, and that the vaccines will even travel to you if needed. So thank you for that, Katrina. I'd like now to open the floor for our attendees. If you have any questions, you can use the raise your hand feature on the bottom of the screen. And once you raise your hand, we'll unmute your mic so you can ask. Or you can also ask anonymously through the question and answers feature at the bottom of the screen. I do see one question. Dr. Hunter, I believe this is a great fit for you. The question says, my parents are fully vaccinated and feeling great, but are talking about the variants and are curious about the next round of vaccines they will need. I think your screen might be frozen, Dr. Hunter. Dr. Bland, would you like to answer the question? I can repeat it if needed.
Yeah, I don't think, right now, we don't know for sure that we are going to need another round of vaccines, or we're going to need a quote unquote booster in the fall. I think people are looking at it, but we're not sure whether we're going to need it. I think we've been impressed, and please, ladies, do enter your thoughts on this. I think we've been quite impressed at how durable the vaccines that we have so far have been. And as far as I have been reading, they're quite durable against all of the variants that we're seeing so far. What the question is, and what we should be more concerned about, is these people who have not been vaccinated, and with these variants that are coming about, they are more at risk than ever before, because some of these variants are quite transmissible. So right now, I don't think we know. We're going to have to wait and see. My main man, Dr. Fauci, is not quite sure yet. So I think we're going to have to just wait and see whether we will need to get vaccines later or get boosters later on. And ladies, please enter.
I just wanted to agree and then re-emphasize, circling back to my first statement about the COVID antibody testing. So like you're saying, Dr. Bland, we're in the middle of checking the efficacy or how effective the vaccines that we already have on board. I will agree with you. In my limited research at Elon, with the participants that we have, the antibodies show up really quickly. So there's a time. It almost looks like a pregnancy test. You prick your finger. It's really easy. The bar turns pink or whatever. And so I agree with Dr. Bland. Our focus really should be on getting vaccinated against the COVID-19 virus that we were combating right now, because I also think it will help because they're all kin, right? And so I'm not the scientist, but the strands are kin. And when I say that, they're similar in their makeup and nature. So if you can beat up one cousin, you probably can beat the second one up if they try to fight you. But and I'm being really funny. But yeah, I think I agree with her. Our goal should be getting vaccinated. It builds your immune system, and at least you would have what I call more of a fighting chance. Even if you were to contact this second variant or whatever, your body still is recognizing that spike regardless, right? And it can begin to help you fight. And so I would agree with you, Dr. Bland.
Yeah, and just to endorse also what Dr. Bland and Dr. Morris said, there is what is called cushion immunity. So having had the vaccine for the COVID-19 that we know provides certain immunity. We understand that it may not be 100%, but certain amount of immunity that is called a cushion immunity towards the variants. And the variants that we have seen, although they're more contagious, like Dr. Bland mentioned, they don't supposed to be that fatal like the COVID-19. So that's why COVID-19 vaccine continues to be essential, because it's the more fatal strain that we know so far. And that vaccination should also provide some amount of immunity that we're still not sure how much it is, but some amount of immunity for the new strains. Very important to continue to get vaccinated for what we know and what we have.
Thank you for that insight on that. Even though the strains are still developing and changing, that you'll at least have somewhat of a chance, so we don't know the exact percentage yet. Katrina, you have a question?
I did. Yes, can you hear me? I'm sorry, I'm having issues. Well, I'm just concerned about how can we effectively move past the barriers or the things where the people are just there. It's become so political. And so some people are not using the science and the research in the way it's intended. They're using the politics. How can we work towards getting those individuals on board? I mean, how do we deal with the social aspect of it more so than the medical?
I'm going to go with this one again, just because, you know, I'm a let's all hold hands and sing Kumbaya type person. That's just, I lived in Colorado for 15 years. I can't help it. And I apologize for my internet just a little bit. I have 3 sons and they're all on the internet. So during my hiatus, I kicked them all off. I'm like, listen, mommy has stuff to do. You all need to get off your devices. Anyway, I mean, honestly, this virus has been turned into a political issue, and because of that, I think some of the things, the steps forward that we could have made has been hindered just because of that. And part of it, I feel, is many people not taking the time to really understand each other. People almost making it, what I've seen is it's people are almost being, instead of taking the time to really explain to people and understand their fears, they're being ostracized for it. I mean, it's okay to be fearful. It's okay to be reluctant and hesitant. But if you don't take the time to go beside that person, meet them where they are, and talk to them, if you're just over here, oh my gosh, you don't care about society, you want us all to die, you're so selfish, you're not going to get anywhere with that person at all. You're going to have to, I mean, I know it's not easy. I know it's annoying sometimes. You know, I am an internist, and I promise you there's a patient that I have when I was in Colorado for 15 years. She came to see me every 3 months, and every 3 months I had the same discussion with her about her diabetes. Sometimes you're going to have to be a little patient with people and have that same communication, that same talk over and over again. If we really are set on moving people and getting people from an area of indecisiveness or reluctance, if we're really convinced that that's what we want to do, we are going to have to go to where they are and take some time to understand where this is from and work with them where they are.
Thank you, Dr. Hunter, because one of my other concerns is that we need support. Public health, I mean, that's where we are. We're here for, as your patients will come to you, Dr. Bland, Dr. Baraona, and Tiffany's, you know, students and everything. Those are your clients, those are your patients. But in public health, the whole community is our client. We're responsible for everything that people are even unaware of. I just wish there was some way that we can get these guidelines, these mandates, and all of these other recommendations enforced, because regardless of what the CDC says, the Department of Health and Human Services at the state level, people are not abiding by them. People will allow people to come into their businesses, their restaurant, or whatever, and without masks. You don't know who's vaccinated now or, you know, now or not. And so it gets a little frustrating because we're working so hard. Everyone is working so hard to get behind this, but it's disappointing when you have that few or that population that just not getting it. They're just not getting it. So I guess I'm trying to keep my spirits up. It's been a long 15 months.
So Katrina, let me encourage you, and I'm going to agree with Dr. Hunter. And although I'm passionate, it takes these small groups. So number one, what we're doing tonight is what you should be doing. It is a small conversation, whoever would like to join. I think we're all being very honest with people and talking straight with them. I feel everybody on this call is genuine. And I want to encourage you, because even my participation with the health department, the Facebook that you all started, giving the updates, the links to get people vaccinated. When I emailed the health department and said, okay, the phone calls aren't working, right? Because it was a backlog. Can I get my members signed up? And you said, yes, you can go online and sign everybody up. So the first thing I want to encourage you is the health department in Rockingham County is doing what they need to do. The onus is on us. As Dr. Hunter said, we have to just keep up the good fight, and people will decide what they want to do. But small community efforts, and it may just take this many. This is probably the 5th Zoom call I've done in the last 6 months. And you would think, well, dag, I did it at such and such church. And then I went to the Reidsville, housing authority, and I did that. And, it's these small pods. But I was excited when they told me 12 people got vaccinated, because when we came, there were 0 people. So, we have to take pride in the small wins and just keep at it, these group forums, and don't assume people are hearing. I think it's Natalie, is that how I pronounce her name? You blessed me tonight. She's like, well, there's some information I hadn't heard. And I would have thought by now the information about the physician, and I don't want to mispronounce her name. I know her last name starts with the K, so I don't want to mispronounce. But the Black female that helped develop the vaccine, I'm thinking that's a wide known, phenomenon. But tonight it's like, well, no, we hadn't heard that. So I think we just continue to educate. We continue to be patient and passionate, and just tell the truth, and then let people, make their decision. And you all continue to provide your information, the resources, and reach out to the community as best you can.
I'll even add to that, my own personal testimony or whatever. I'll be honest, I was vaccine hesitant. I absolutely was. And I'll be 100% with everyone, just because, I don't know, I think it was just too much. The whole pandemic, the whole kids at home, the whole seeing patients, it was just too much for me to have all, and now I have to think about getting a vaccine. That it really was too much. And I had to sit down as a medical professional, and I became part of a group of medical professionals that were talking about the COVID vaccine. And that's where I kind of sat and thought it through and decided to get the vaccine. So just if that will help anybody out there, I'm a doctor. I understand all that was going on, and I myself was reluctant to get it, but I did end up going forward with it.
Thank you for your candor, Dr. Hunter. You actually spoke about your kids earlier. Not sure how old they are, but someone in the question and answer box did ask, how do you feel about vaccinating children between the ages of 12 and 16? Anyone can elaborate.
Okay, so the studies that were done with the Pfizer vaccine included populations as young as 14 years of age. So they had some data on that. And after the vaccine was made available for adults, then the Pfizer extended their studies to patients between ages 12 and 16. And what it has been seen is actually remarkable. So where we do have close to 95% of effectiveness with the Pfizer vaccine, is close to 100% with children. And what does that mean? Well, people will say, well, children don't get that sick. Some of them do. And it's hard to know which one is the one that is going to get this, what is called a MISC which is a multiple system inflammatory syndrome that can even cause death. And it does not follow the same rules. Of course, kids that have children that have other comorbidities will have more risk, but even healthier children have been affected by the syndrome and being very sick, and some of them even die. The numbers are not the ones that you see in the adult communities, but it's still, you don't want your child to be the one going through something like this. In addition to that, having children vaccinated helps in the control of the pandemic, as children may transmit the virus even if they are asymptomatic, as we have seen also in the adult communities. So it's extremely important to try to get our children vaccinated. I wish that the person that made that question may have elaborated, because it seems that is certain concern behind it. And, you know, we can talk a little more about specific concerns, but they have been, in the data that we have, they have been shown to be safe for children and now for pregnant women, and beneficial, especially that we have that incredible response and close up to 100%. We rarely have any interventions in medicine that are close to 100%, which I think is something something to be wowed by, the type of medicine that we have in our day and age. So that is what I have for that.
Thank you for that. I believe in Rockingham County now, ages 12 and older can be vaccinated. And I do have one more question. It'll be our final question of the night from Rebecca Oakes. What are the current isolation protocols for someone who tests positive for COVID?
Can you repeat the question, please?
Sure. The question was, what are the current isolation protocols for someone who tests positive for COVID?
Okay, so the protocols stay the same. So the patient should be isolated if they don't have significant life-threatening symptoms. And I hope I'm answering the question that I thought that I was asked. For 10 days, between 10 days and 14 days, which is where we think is the highest of what we know so far with our studies, the highest days for replication of the virus. Once those days are after the 10-day or the 14-day, and if the patient starts feeling better and having less symptoms, we understand that the body is starting to make their own immunity, and the neutralizing these virus and decreasing the risk of transmission. So the patient may still be positive for the virus, but because they're getting better, their immune system is neutralizing the virus to the point that it will not be contagious to the rest of the community. This is true for most of healthy population. Of course, people that has other illnesses, and my co-panelists can go possibly in a little more depth into this, such as diabetes, hypertension, advanced age. All these people may take a little longer to clear the virus. So if the person is still feeling sick, should still stay at home in quarantine. Within the home, I have recommended my patients to follow the same if possible, because some of them, of course, need a lot of care, and maybe, you know, older adults, people with disabilities. So both the patient and the other members of the family should wear masks, should try to stay, follow the social distancing inside the home if possible, to prevent the spread inside the home. Definitely, after the 14 days, the patient, I always encourage the patient should continue to follow protocols, wearing masks, washing their hands, doing all this stuff once the quarantine is over. I hope that I answered the question.
Thank you for your insight. So if someone has the virus, they should try their best to social distance at home and wait until the symptoms have subsided, if I understood correctly. Thank you for that. And thank you, ladies, for all of your insights. I am now going to share a couple of announcements from the Department of Health and Human Services in Rockingham County. So there is a free vaccine available, as we've talked about throughout the night, and it's available at the Rockingham County Health and Human Services building. That address is here on the screen, and the link to sign up for your appointment will be placed into the chat momentarily if it hasn't already. Please sign up for that. From what I've seen, there is availability next Thursday and all throughout July. Not sure how long it'll keep going, but we definitely would encourage you all to get vaccinated as soon as possible. And if you have your phone, you can take a picture of this, you can screenshot it, however you need, but please check the chat for the link to sign up for your appointment.
Natalie, can I add a little bit of additional information? On Thursdays, it's the first vaccination only. Of course, we have other clinics that are open now. So if someone comes in on another day, other than Thursday for another appointment, they are still, the vaccination is still available. We're still supporting the Bring Summer Back campaign, which the individual receiving the vaccination will get a $25 gift card, as would someone who's providing the transportation for them. So we encourage everyone to take advantage of the service that's provided from the North Carolina Department of Health and Human Services. Anytime you need to come, walk-ins are welcome. We prefer that an appointment is made, because there was a time when it wasn't the supply that was the issue. It was the supply that was the issue. Now this is not the issue, but we still like to have things in an orderly fashion. So if they can make an appointment, that is fine. If they can't, we'll accommodate. And I hope that maybe the $25 gift card will serve as an incentive for people to get vaccinated. And some people have questions of, okay, well, I have a minivan and it holds 11 people. Can I just bring 11 people and get a $25 cash card for each individual? Unfortunately, no, that's not the case. You can't do that. But if you bring 11 people with 11 different visits, you can receive the gift card. So I think they're trying to have a little accountability about it. And but we encourage anyone that has the time and the compassion to be a transporter. We're looking out for you, Tim. And we appreciate your efforts as well.
Thank you for that. I would like to reiterate that for the Rockingham County Bring Summer Back program, there is free transportation in the Eden area only from 9 a.m. to 3 p.m., but that you can also receive a free SCAT card for free transportation. And the contact information for that free SCAT card is on the upper left-hand side of this slide. Please contact Kathy Powers, take a picture of it, screenshot it. The information is there for you.
Oh, can I say, I'm sorry, Natalie. Things have changed since we last talked. Kathy Powers, she's the executive director of Disability and Transit Services. And she's actually on vacation. To make this more seamless, they're not providing the bus passes. They are actually making transportation free from 9 o'clock to 3 o'clock on Saturday, this July the 10th, for anyone that's needing transportation. to anywhere throughout the Eden area only. So all you have to do is, just kind of just give me a call if you want to share my information. And I'm so sorry for not providing this sooner. But they can just give me a call. I can give them the details. But anyone who needs transportation anywhere on July 10th, that organization has made that transportation issue not a barrier. But we're hoping that you will use it to come to the Bring Summer Back event. And that would include the transportation there and the transportation from. And again, it's from 9 o'clock a.m. to 3 o'clock p.m. And yeah.
Thank you for that clarification. That's awesome that the transportation in Eden is free regardless of where you're going, but we do encourage you to use that transportation to get vaccinated. I do have Katrina's phone number written here on our contact screen in case you all have any more questions that you would like to ask the Department of Health and Human Services in Rockingham County. NC100 and LatinX L.I.F.E are nonprofits that collaborated on this event. We would love to hear from you all. Please follow us on our Instagram and our Facebook. We can't wait to interact with you and meet you more. And I just want to thank all of our panelists for joining us tonight. I definitely learned a lot, debunked all the TikTok myths that I've seen. So thank you so much for that. And yeah, thank you.
I want to thank you all too. I'm sorry. Oh, I must be muted. Can you all hear me for a second? Oh, okay. I just want to thank Dr. Bland, Dr. Morris, Dr. Barahona, Dr. Hunter, everyone. I want to thank you, Natalie, NC100, LatinX, L.I.F.E, Reidsville Area Foundation for making this available and giving us an opportunity to start this dialogue. I'm hopeful that it will be the first of many. And I think it's a great job, everyone. I know our physicians and our educators are extremely busy with your day, but thank you so much for taking the time to be a part of this. And just, I think you're great. Wonderful. Meryl, thank you. NC100, Rule Forward, participants, thank you so much.
I want also to thank you all. This is wonderful. And I also learned so much from my co-panelists. So thank you. And thank you for the invitation and thank you for the great insight. Thank you so much. I'm glad to see that we all from our different little fronts are trying to combat this terrible pandemic. And I think slowly but surely we will succeed. Thank you.
I thank you so much for the honor of being asked to be here. And I'm so happy to see all this girl power here also. It's just wonderful to have all of this. Just wonderful to see all my sisters here like this. So I thank you so much. And, I practiced in Reidsville for many years, and I still have a large amount of patients from Rockingham County. I love you all, and I want you all to get your shots. It's just so important. I think I'm just tired of saying it so much, but I really think it's important. And I hope that everyone feels the love and the care that I think all of us have for our patients and for the public in general. We only want the best for you. We only want the best for you.
Ditto, and stay safe.
Ditto, and stay safe also. Thank you all for having me.